Okay, we're back. We're in chapter 14 of Fundamentals of Therapeutic Massage. Let me see if I've got any coffee left. Okay, so we talked about animals and athletes. So let's see what's next. Okay. This is an interesting topic. Breast massage. Here's the deal. Males and females, there is no reason to massage the breast tissue proper. If there has been an injury or a surgical procedure or something like that to the breast area, then you are going to work on the scar tissue or the muscle tightness or the soft tissue changes in the area. Because of the unfortunate overlap of the breast, which is part of the integumentary system, but crosses over into the reproductive and sexual area, then we get confusion here. And while you might be of the have your own morals and values around parts are parts, and I'm not sexualizing this and all of that, you have to be aware that this occurs. So this is the moral dilemma here. And the cautions that are talked about in this segment are related to navigating that. And again, fair or not, whether you're trained or not, male massage therapists should not work in the breast area of a female. And you need to take extra concern with the draping, the use of that rolled towel we talked about that's going to come along the side and mask the breast area, and inadvertent touch of the area, because it can easily be misinterpreted. If you have a client, you're a male massage therapist, and you have a client that could benefit from massage on the tissue around the breast area, let's say they had a breast reduction and there's scars in the area, then you should refer. Now, you may not like that, but I've been around longer and it's not worth it. It is not worth putting yourself in a situation where you could be accused of inappropriate touch. So just don't. And you need to avoid the nipple area on both males and females. And it is less of a concern on the male chest, but you still have to be aware. So that's the conundrum, not massaging the area. So there's special permissions that are required. There may need to be a level of supervision, having somebody else in the room, for example, just to protect yourself that somebody doesn't misinterpret touch in this area. So this is the nature of this particular section. Now, it doesn't mean that you can't work around the breast tissue. And here's an example in this picture how I want to get to the tissues under the breast, and the breast tissue, especially when the client is supine, falls to the side, and it might get in the way of wanting to work in the anterior chest area. Now, typically, if you put somebody on their side, the breast tissue will fall towards the table and it will solve that problem. Or you can use your forearm, not your hand. You can use your forearm over top of the drape in the area to push the breast tissue away from the area you want to work. Okay. Pregnancy. So this has carved itself out as a specialization, and there's lots of myths here that we're trying to get beyond, that persist, that sometimes interfere with whether or not somebody will work with a person who is pregnant. And it usually revolves around the first trimester. And there is no spot to push. There's no way that oh my goodness, this is crazy in here, that is going to cause a miscarriage. The issue is that pregnancies don't always work out very well, and the body will recognize that, and it will stop that pregnancy. And it's called a miscarriage, and it usually occurs in the first 3 months, and there's usually something wrong. And if there's with the embryo, something genetically. Occasionally, if the miscarriage occurs later, there might be something to do with the placenta attaching correctly, or the cervix, the integrity of the cervix, and the pressure of the weight of the growing baby will cause the cervix to open. Sometimes they don't even know about this until it has happened once. So there is, unless you have been totally inappropriate, and it should be really severely chastised for that, like doing really, really aggressive pressure over the abdomen or whatever. For pregnancy in general, and it is a normal state, but it does have a lot of physiological changes to it. The massage is safe, and the adaptation is related to what the comfort and changing the intensity primarily of the massage over the abdomen area. But because of that tendency for spontaneous miscarriage in that first trimester, some businesses don't want the legal liability related to that. And so they won't allow massage until after the first trimester, or 12 weeks. I get it. Our family owns a franchise. It is the policy of the brand to not massage during the first 3 months, first trimester, because of the liability issues. It frustrates me. At the same time, I understand why that policy is in place. But it's not because you push on a spot on the ankles or any of that kind of stuff. And pregnancies these days, lots of times there's a lot of energy on it. People are waiting longer to have kids, and takes more effort to conceive, and you know, like almost the next hour, next day, with home testing kits that you can get. And so these pregnancies that would be non-viable and are miscarried, uh, many times in the past, way back when, we didn't even know. We just thought maybe our menstrual cycle was disturbed a little bit, and then we might miss a cycle, and then we might have a really heavy period or something, and it went like that. But today, because of the ability to test uh, for a pregnancy very quickly, then people know, and then it has a different energy around it. So you're going to have to make your own professional decision on that. And if you work in a particular environment, you're going to have to um, follow those policies. This content goes with content in chapter 12 in Essential Science. So that's where the reproductive system is discussed. And this area is pretty robust. And the information here is sufficient for you to work with a normal pregnancy. And there's an increase in an awareness of where the pregnancies can become more complicated, and what you would need to look for referral. And you would want to make sure that the client is communicating with the other professionals, be it an obstetrician or a nurse midwife or a lay midwife or whatever, that your massage therapy is part of how the client is working through the pregnancy. And there are a lot of changes, and massage can help a lot. So we already mentioned in another segment about positioning, side lying in particular. And so, that is going to become more necessary in the second and third trimester, or weeks. Each trimester is approximately 12 weeks. Sometimes there's a tendency now to describe the pregnancy in terms of weeks as opposed to trimesters. So combine those two knowledge points, and you can also do some self-study on this by learning more about pregnancy. This may be an area like sports, working with athletes, where you might want to get some continuing education related to working with people who have experience and expertise in working with the pregnancy from beginning through postnatal, where I personally think that there needs to be more attention. We need to be a little bit more aware of the depression and the hormonal shifts that can happen post delivery, and look at that. And it might be worthwhile to have some additional education about that. So here are your recommendations. I have worked with a lot of women as they have gone through this whole reproductive cycle. And every pregnancy, every experience, every family support dynamic, all of that has to be taken into consideration. And you also have to take into consideration the hormonal changes and body changes that are put into action with a pregnancy, and how that takes time for the body to return to a non-pregnant state. And if there has been a miscarriage or a termination of a pregnancy, you can have a lot of symptomology that occurs as the body returns to a non-pregnant state. The massage approach is in our palliative, restorative category of care, looking at relaxation and stress management, and focusing on the breathing, which is also in chapter 12 in Essential Science and talked about extensively in the next chapter in this textbook. And to backtrack, with athletes as well. Breathing is a huge issue, and the breathing changes with performance. And so an add-in for athletes and for pregnancy is attention and understanding of the breathing function and mechanism. So here's a little schematic here, here's a picture sequence. Also teaching the support person, regardless of the gender nature of the parental unit. That can be all kinds of combinations, and we respect gender fluidity. So now you might be part of labor, probably not, but you may be part of that. I have been, and depending on where the birth is occurring, you have to be very aware of how your presence is going to influence others that are working with the delivery. So I have mostly been attending with a birth in a hospital type setting, in a pregnancy suite. And so you got to know when to step out of the way. And you don't want to have your presence overarching as an influence in the environment. This is not about you. You need to know how to be invisible in that environment and to help as needed. To be perfectly honest with you, I'm not a fan of this. I have done it because it has been requested by both parties, both parents, and there's been an approval of the, whether it's the midwife or obstetrician or whatever. But I think that I see this as an acute, if you want to look at an example, I see this as an acute situation where massage is probably, the benefits are not worth the interference that can occur. Now, there is a support person called a doula. And so there has actually been some research that shows that women that are attended by a doula during birth, and the doula might do some massage. So if you really wanted to be part of all of this, then you might want to get additional training as a doula. Okay, here is where I think massage therapy has its most value, is in the postpartum, the return to a non-pregnant state, where there is so much chemical soup going on, and there is sleep deprivation, and there is changes with how we function. You know, carrying a baby around. I have my grandchildren were a little spread out, and I've got at this filming, I have a 3-year-old and a almost 2-year-old. And so this is fresh in my mind. I would carry those babies around, and then the next day I would wonder, oh my goodness, why am I so stiff? And then I realized it's that almost like an isometric, consistent tone change to hold those little people, and the weight shift it took from holding them in the front, and then now as they're older, lifting them up, and it's just a whole different action than what I do and a general day. And so I won't get sore like that doing massage, because that's like a performance demand. I'm used to it. I've adapted to that. But carrying these little people around or getting up and down off of the floor, that you know, body function, movement function that I don't normally do, and then attentive function, like listening if they're going to wake up at night, and you know, so the parents in the postpartum process, they have to deal with all of that, including the hormonal shifts around lactation and changes in the relationship between the two parents. And so much happens in the postpartum period. And this can easily become a depression. There can be some post-traumatic stress involved with this, and it can even progress to a psychosis. So do consider the importance of the postpartum period and your role as a massage therapist, as an observer, and with an objective view on when you can see these things, and appreciate all of the life changes and the relationship changes, as well as the physical changes that go along with all of this. It's a complex time. So let's see what's up next. Pediatrics. So that follows right on, right? And I have worked with kids. I've massaged my grandchildren. I massaged my kids even before I was a massage therapist. My 2-year-old grandson, as soon as I sit down, he flops down and sticks his feet in my lap. So that being said, generally, a healthy individual who fits into this pediatric age range probably isn't going to get regular massage. But you certainly can teach the parent how to do this. And that can support bonding, and it can be a valuable way to calm a child down, etc. Even if there is a condition, like I've worked with kids that have had open heart surgery and some of the scar tissue management and stuff that's happened through there. And I have worked with kids with cerebral palsy, and the neuromuscular interaction there that is not controllable necessarily voluntarily, and to try to give these individuals some comfort. But mostly I have taught parents. The exception has been adolescent athletes. And I have worked with them more in the the athletic realm as opposed to the pediatric area. And so the age range was another thing to consider as I developed a unique treatment approach for them. Another place is if there is chronic pain, the child has had to undergo cancer treatment, but then you would fall into your oncology type approaches. An area that kind of is unique to this is that of infant massage, and that usually is more about teaching a parent than it is, or a caregiver, than it is developing a clientele of infants. So this is going to give you some quick overview of the stages of growth and how the body changes, and some of the interaction. And this is Luke, and he's demonstrating in the video here with this little person some general massage techniques. This one is reinforcing gait, cross patterning with cross body function and joint movement, showing how to, because little people get generalized aches and pains too, how to work with, some little tender points and stuff. And so this is a well baby idea, helping a parent. Okay, now this is more of a, we're mocking up here an infant where there is some sort of concern. This baby in this picture in and of itself is perfectly fine, but the attention, the focus and the attention and the understanding of the experience of the parent is important, and helping them understand things that they might be able to do for comfort care or as sensory stimulation as part of what other professionals might be doing to help a baby. There is a difference. If you look at the interaction here and the interaction here, you can see that there is a difference in the emotional context of what's going on. Okay, so here is a figure. I wanted to show you this before we cut this video. This is me working with an adolescent, tween, and mocking up again the communication with the caregiver, the parent, the guardian that has to be present, but focusing on the client, the kid here, because they can give you feedback and communication, and also some adaptation to a mat and working over clothing. And it's been my experience that this age range, they really like massage. Nothing real special, nothing particular, but they do like massage. Okay, so the next segment we're going to look at is working with our geriatric or older population, which I now am part of this group. So here we go. Let's stop the share. And I want to point out that a lot of what you do with infants and kids is in the interface is very similar to how you work with an animal in terms of communication and needing to get most of your information from the parent, but at the same time, maintaining a focus on your client as the primary intention. That can be interesting to navigate.